Hello and welcome to Health 247 on Rapid Television, your trusted source for health insights, expert advice and inspiring real-life stories. In today's edition, we take a closer look at diabetes, a condition often linked with hypertension and what you need to know to stay healthy. I am Josephine Bitrus. You are still watching Health 247 on Rapid Television. Hypertension, commonly known as high blood pressure, has long been recognized as a silent killer. But what many people do not realize is that it rarely works alone. Today, we examine diabetes, a closely linked condition that often develops alongside hypertension, silently increasing the risk of deadly complications. In Nigeria, both hypertension and diabetes mellitus are becoming very common health problems. Many adults have high blood pressure and diabetes is rising quickly across the country. These two conditions are closely linked. High blood sugar from diabetes can damage blood vessels, which can lead to hypertension. Diabetes mellitus is a long-term medical condition where the body cannot properly control blood sugar, that is, glucose levels. This happens either because the body does not produce enough insulin, a hormone that regulates blood sugar, or the body can't effectively use the insulin it makes. In simple terms, glucose builds up in the blood instead of being used for energy, which can lead to health problems over time. The most common symptoms of diabetes mellitus include frequent urination, excessive thirst, increased hunger, unexplained weight loss, fatigue, blurred vision, and slow healing wounds or frequent infections. There are three main types of diabetes. In type 1 diabetes, the body makes little or no insulin. Type 2 diabetes, the most common type, happens when the body doesn't use insulin well or resists it.
We have two types. We have the type 1 and then we have the type 2. It's very important that we know the distinction between the both of them. Before I go into their differences, I just want to quickly note that in our society, what is prevalent or more common is the type 2 diabetes. Now, between the type 1 and the type 2 diabetes, for type 1, we want to look at what causes type 1 diabetes and what causes type 2 diabetes. For type 1 diabetes, it's specifically the destruction. So it's an autoimmune disease, and it's as a result of destruction, like complete destruction of the beta cells of the pancreas. Remember I said earlier that the beta cells is what produces the insulin for our body to be able to break down sugar, blood sugar, for the cells to use. So when they are completely destroyed, then we will not have insulin produced. So that's for type 1. Now for type 2 diabetes, it just has to do with the insulin is produced all right. The beta cells are there all right, producing insulin. But for some reasons, they are not sufficient, or there is reduced sensitivity. So what happens is that there are receptors in the beta cells that helps to take the insulin that is already produced from the beta cells to the rest of the body or to the blood, where it can be taken up by the cells of the body. So when those receptors are not, they are not in adequate number, then even when the insulin is present, they will be trapped and will not be able to leave the pancreas or the beta cells into the rest of the body or the bloodstream where they are actually needed. So that's talking about the cause. Now, between type 1 and type 2 also, we want to look at how, the onset, when does it start? Generally for type 1 starts typically in childhood or adolescence, young, maybe older kids not necessarily children, but maybe kids between 11 to 15 thereabouts. Now for type 2 diabetes, it usually starts in adulthood. But that is not to say that that doesn't mean that one cannot see type 1 in older people, maybe in adults, and one cannot see type 2 in younger people. But typically that's how they usually present. So one onset is earlier, one occurs later. Now for type 1 diabetes, we also see a situation where the patient will look very lean, very gaunt, lean, like he has lost so much weight. But for type 2 diabetes, most times they even come and they look very robust, very plumpy, very big, usually on the bigger side. Then another thing is that for type 1 diabetes, usually because it has to do with, it's an autoimmune disease, and it causes destruction of the beta cells. So we don't even have insulin there. So what happens is, the way to treat type 1 diabetes is usually use of insulin. They have to take insulin for life. But for type 2, we can approach it multidisciplinary. We can either use the lifestyle modification, diet, exercise, as well as oral medication. Yes, there are some times that type 2 diabetic patients might require insulin, but usually that happens maybe later or at some point in the course of their treatment. So these are some of the differences between types 1 and 2 diabetes mellitus.
Lifestyle has a strong impact on both the risks and management of diabetes mellitus. Unhealthy habits like poor diet, lack of exercise, smoking, and excess weight can increase the risk of developing diabetes, especially type 2. On the other hand, healthy choices such as eating balanced meals, staying physically active, maintaining a healthy weight, and managing stress can help control blood sugar levels and reduce complications.
Okay, so when we talk about diabetic risk and management, we are actually just talking about, we talk about lifestyle impacting diabetic risk and management. We are looking at it from the angle of prevention, before one has it, and then from the angle of, okay, after one has it, what next, or what do we do? Now, one way to prevent it is, usually I would start from this: know your family history. If there is a family history of diabetes, it's better you know on time. That will help you, that will inform your decisions and also inform your choices. That will help you to start modifying what you eat. You try to avoid taking excess carbohydrates, processed foods. You want to avoid also taking foods that are very high in sugar, sugar that have been processed over time. Now you want to reduce that intake and then focus more on taking whole grain, focus more on taking fibers, foods that are rich in fibers, focus more on vegetables, and then having a very good combination. Now, it's important to note at this point that for diabetes generally, or humans in general, we all need sugar for our bodies to have energy to function, even the brain especially. So even diabetics cannot run away from not taking, foods that have some sugar content. However, for diabetics, they usually do what we call portion control. So they try to reduce as much carbohydrates as possible and then increase the quantity of either proteins or vitamins or fibers. So that's one. Then another one too, if for people who are on the large side, who are obese, who need to lose weight, then we talk about weight loss too. So weight loss exercises, doing things to help you to be able to regulate your weight, and then of course you monitor what you eat. Then avoid fizzy drinks. Fizzy drinks have never been known to be very good or beneficial for the body. So you want to avoid that as well. Now, when we talk about management of the disease, we talk about glycemic control. You want to now start monitoring your blood sugar. You want to now start taking note of specific foods that you should avoid. For some people, they eat a little quantity of eba and then their blood sugar just spikes. So for that one, they already know, okay, these are these kind of foods to avoid, then they begin to avoid it. Another way is to work with your dietitian. Your dietitian or your nutritionist will help you put a food, a kind of a food plan, could be weekly or daily, and then we tell you, okay, these are the things to avoid. And one thing also, you want to monitor your blood sugar by using the glucometer to check. Now, for people who are admitted into the hospital or who have been newly diagnosed, who are still trying to understand this whole the disease itself and how to navigate, we usually encourage them to have a glucometer handy. Then before food, for each meal, before and after, they take their blood sugar. So 30 minutes before the meal and 2 hours after, you try to take the measure the blood sugar, and then know that, okay, this is the food to avoid and this is the food to encourage.
Recent advances in treating diabetes mellitus focus on making care easier and more effective. Improved technologies like continuous glucose monitors and automated insulin pumps allow real-time tracking and better control.
Normally for diabetic treatment, we've had the usual first line for diabetic treatment is metformin. So usually somebody who has been newly diagnosed, we just prescribe metformin, and that was. But now there are newer diabetic medications that have come out that have also proven to be very effective. And one of them, I'll give just 2 of them. One of them is the sodium glucose transport proteins. For short, it's called the SGLT2 inhibitors. So what this group of medication does is that it helps to protect the kidneys and also protect the heart. Usually, when someone has diabetes and the diabetes is not poorly controlled, the target organs that are affected are usually the kidneys and the heart. And that is where we see somebody will have a silent heart attack. Very silent. And like I mentioned earlier, for type 2 diabetes, which is very common in the population, is very insidious in onset. And what do I mean by insidious? It's not an acute presentation, it's chronic. So somebody might even be diabetic over time and will not know for type 2. And for people like that, the risk of that is when the excess sugar in the blood begins to damage the blood vessels here and there, the target organs that suffers the most are the heart and the kidneys. And in a situation like that, the person can just come down with what we call a heart attack, and we not know. So we call it a silent heart attack, as well as the kidneys. So this group of medications help to protect the kidneys and the heart. So the excess blood, the medication will bypass it and prevent, not the excess blood, I mean the excess sugar, I wanted to say. The medication will now bypass and prevent the kidneys and the heart from taking up that sugar. Then a second group I want to talk about, so one of them is also the glucagon-like peptide 1 agonist. So those ones also help to protect the heart. So it's cardioprotective, and also it kind of slows, regulates blood sugar and then slows digestion as well. So these are some of the.
Managing diabetes effectively involves maintaining stable blood sugar through consistent habits such as regular monitoring, eating a balanced diet rich in whole foods while limiting refined sugars, staying physically active, and taking prescribed medications like metformin or insulin when needed.
Now, when we talk about diabetic screening, we want to look at the population of those who have a high risk to developing the disease. For those who have family history, you want to, in fact, as a young adult, you want to start checking or monitoring your blood sugar. It could be the random blood sugar, or it could be the fasting blood sugar, or even it can be the HbA1c, the glycated sugar. So you want to know, well, usually for those who who are at low risk could check maybe once or twice a year. Now, for those who are at high risk, those who have the family history, for instance, like I said, or who are obese, who live sedentary lifestyles, you want to check regularly, more frequently. So you would come in and like every 3 months. Now, for those who are newly diagnosed as well, it's usually every 3 months or between 3 to 6 months. Now, as time goes on, based on the discretion of your doctor, they might decide to reduce the number of hospital visits from 3 months, and then it's maybe 6 months. So every 6 months, they come in and then they get checked. So between 3 to 6 months per year, yes, every year.
Unmanaged diabetes can lead to serious complications over time, as persistently high blood sugar damages blood vessels and nerves throughout the body.
The potential complications of diabetes that is poorly controlled, that is not well managed, there is vast. Now, first of all, diabetes, when we talk about high blood sugar, high level of sugar in the blood, they generally like to target tiny blood vessels that are present at our fingertips, at our toes too, as well as the heart, some very important organs in the body. So what happens is that over time, if sugar is left in the blood for so long, not controlled, nothing is done about the sugar there, they tend to damage those blood vessels. So when blood vessels are damaged, of course, it's going to reduce the channel through which blood can get access to different parts of the body. So just imagine if the blood vessels are damaged at the tip of the fingers. It means that there will not be blood supplied to our fingers, and then with time, the nerve endings that are also connected to this to our fingers here, because for the nerve to be sensitive, we need blood to also perfuse these places. So the person begins to lose sensation. The person will now start having damage. Of course, loss of sensation, loss of blood supply, cells begin to die in those areas. So when the person has a prick, he will not even know. He has a prick in the feet, he will not know, or in the toes. And then before you know it, it develops sores. And those sores, over time, will now become infected. And from infection, it can lead to sepsis, it can even lead to death, if not checked on time. Sometimes, even if it doesn't lead to death, it can lead to loss of limbs. So you see some people's legs will be amputated. So we usually encourage people who are diabetic to not only aim to attain very good glycemic control, we also want to encourage them to wear shoes that are very free, and their feet or their toes are able to move freely, and they also check for pricks regularly. Another complication too is heart attack, what we call myocardial infarction. So somebody can just suddenly, quietly, just have a heart attack. It's not uncommon to hear that someone was sleeping and didn't wake up due to a heart attack. It can also cause loss of kidney function. So gradually the kidneys begin to fail. Now this is in uncontrolled, take note. For those who have very good control of their blood. So another complication for diabetes is for those who, especially for diabetes that is poorly controlled or uncontrolled, that like, the person has it but does not know. One of them is it can lead to vision loss. Yes, there's something we call diabetic retinopathy. So there are tiny blood vessels in the eye, at the back of the eye, which high sugar in the blood can destroy or damage, and leading to vision loss. So you want to also get your eyes checked. In that kind of process, you want to visit the eye doctor, the ophthalmologist, who will check the eyes, and if there is any treatment or anything, intervention that needs to be done, can be done in the process.
Should have regular checkups to monitor their condition and prevent complications, typically visiting their healthcare provider every 3 to 6 months, depending on how well their blood sugar is controlled. Key screenings include an HbA1c test at least twice a year or more often if needed. Annual eye exams to check for retinopathy, yearly kidney function tests, regular foot examinations, and periodic blood pressure and cholesterol checks. More frequent visits may be necessary if complications arise or treatment plans change.
Before, we used to have this glucometer that people will just prick maybe 6 times a day, or depending on the number of times as directed by their doctor. So these days now, we have what we call the continuous glucose monitoring. So it's something that looks like a small chip that one can just put on the skin. So it monitors the blood glucose throughout the day for a while, maybe up to even 4 weeks, a month, or 5 weeks, and then it's changed. So that's one of the it's one of the advancements in glucose monitoring or diabetic research and technology that has come up recently.
Experts say family members can support someone living with diabetes by encouraging healthy habits like balanced eating and regular exercise, helping them stay consistent with medications and blood sugar monitoring, and learning to recognize signs of high or low blood sugar so they can respond quickly. They emphasized that emotional support is just as important. Being patient, reducing stress, and avoiding judgment can make daily management easier, while attending medical appointments or checkups together can also help the person feel supported and stay on track.
One thing I will always encourage family members to do is read more on the condition, know what the condition is about, and then be more empathetic to a relative who has that condition. So you try to offer support, if it's financial support, moral support, you encourage, you you try to be actively involved in the person's management or in the person's treatment. If it means helping the person out, cooking, and engaging in research, both of you sit down to read. So if you have a spouse who is diabetic, for instance, you could offer support by also engaging in also the type of diet that the spouse eats. So it doesn't look like the spouse is alone in the whole fight. Try to encourage them, let them know that you are. In fact, it's more of what we call psychological and psychological encouragement anyway. So you try to support them psychologically, give them emotional support as well, and let them know that they are not alone in this condition.
A diabetic patient should focus on understanding the condition and building simple daily habits.
Okay, so my advice for somebody who is newly diagnosed with diabetes is that with the right approach, diabetes can be managed. I will always say this with respect to chronic medical conditions, that it is not a death sentence, and it's not an indication that one's life will be cut short. As long as you are able to get checked on time, you try to reduce any amount of denial. It's not easy to accept a new diagnosis, but you need to tell yourself that this has come, so how do we manage it? Now you work hand in hand with your dietitian, you work hand in hand with your doctor, you make sure that you go for regular checkups. Whenever you are told to come, please come. Whatever medication you are told to take, please take it. And if over time it's well managed, you are able to eat properly, you do proper exercise, and you also you are under monitored care. And by monitored care, I mean going for regular checkups. With time, the dosage of your medications can even reduce, and then everything, just maintain a very positive attitude, engage in wholesome activities, things that will rejuvenate your spirit, not only your body. Think about positive things, and then always make sure that you have your blood sugar under control.
Diabetes is not just a disease on its own. It is closely linked to hypertension, which makes it even more dangerous. Understanding this connection is crucial. Early detection, proper management, and lifestyle changes can make a life-saving difference. Next week, we will explore stroke, another condition closely related to hypertension that has tragically led to untimely deaths. Until then, eat well, stay healthy, and take care. I am Josephine Bitrus.